In terms of medical news, we got Florida with 15,000 plus over the weekend, more than being offset, of course, by this fast-track Pfizer BioNTech news. How are you seeing it right now, Jim?
Oh, you know, people ought to go and actually read the article, the interview with Albert Bourla, because this is not what you... Now, everyone is very excited about everything these days, but I do think that you have to understand that he says, listen, it's basically, it's free. To some extent, he says, we're not going to give it away to governments. We're going to charge governments a very, very nominal value. So I don't know how much they're going to end up making. But he just says, listen, we're kind of throwing $1 billion at it. And if it doesn't work, we're going to write it off. I did not find this as reassuring as others. I love the time frame, but I also do not like, hey, you know what? We're going to make a lot of the vaccine. If it works, great. If not, well, we're just going to write it off. That's not what you want to hear, and it could be a big write-off. Okay, I'm using a new term for Pfizer. I think they're rolling the dice. He says we will throw it if the FDA rejects it. He said we are just going to have to write it off and call it a day. Call it a day? I don't want. Do you want to be part of the 30,000 people who might be calling it a day? David, would you take that little virus? I'll give it to you, and if it doesn't work, why don't you just call it a day over there?
No, that's probably not the route we're going to go, or not the route that I would want to go. But to your point, you do need large-scale trials where you can prove the safety of the drug or the vaccine amongst a very large group, because when you're giving it to potentially what may end up with hundreds of millions, if not even more, billions of people, you want to make sure you're not giving them anything, Jim. Right. We are very focused on that because we on the vaccine, on the antivirals that are available now, and hopefully ones that will be available soon that will act earlier, an onset of the virus, Jim, because it doesn't appear that our mitigation efforts are going particularly well in certain parts of the country.
No, and they did throw Dr. Fauci under the bus. We had commentary about this morning. Look, people, if you have the science and you're trying to interpret the science, well, hey, you can get it wrong, but obviously he's under pressure from the president. The one thing I was seeing that's creeping into the numbers for the first time, Carl, is people are talking about when we get the vaccine. Now, that's something that Pfizer said. It's not if, but when.